Your NCLEX exam patient has sudden shortness of breath with absent lung sounds on one side. What should you start prepping for? Answer at the end. Lung sounds tell you everything about your patient's respiratory status. Crackles? Think fluid overload, pneumonia, or atelectasis. Wheezing, asthma, COPD, or an allergic reaction. Stridor? That's upper airway obstruction, an emergency. And absent lung sounds? That's when you worry. Before you document silence, listen carefully in all lobes. Back to the first question. SOB with absent sounds on one side. If one side of the patient's thorax is completely silent with respiratory distress, think pneumothorax, a collapsed lung. Emergency intervention is needed, like a chest tube to help re-expand the tissue and allow for adequate gas exchange and ventilation. Know these signs, trust your assessment, and you'll be ready for test day. Subscribe for more NCLEX prep, because yes, you can master your nursing licensure exam.